Greetings, Dr. Nyundu. I go by the name Nzuzo Mpondwana. We are group number 9. We will be talking about diabetics, which is known as diabetic mellitus. On my left, these are my group members, which is Mr. Machiza, Ms. Toa, and Ms. Moeng. Moving on, I will take you through on what is diabetic or diabetic mellitus. Diabetic is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose. Hyperglycemia is also called blood glucose or raised blood sugar. Is a common effect of controlled diabetics, and over time it leads to a severe damage to many of body systems, especially nerves and blood vessels. In 2014, about 8.5% of adults aged 18 years and older had diabetes. In 2019, diabetes was direct cause of 1.5 million deaths, and 48% of death due to diabetic occurred before the age of 70 years. Another 460,000 kidney disease deaths were caused by the diabetes, and raised blood glucose causes around 20% of cardiovascular death. I will move on. I will hand over to my colleague to proceed with the diabetes.
Before types of diabetes, I would like to take you through the misconceptions of diabetes. There are common misconceptions of diabetes, which are obviously most people tend to say someone who is diabetic shouldn't be eating sugar or carbohydrates. They say that person shouldn't be exercising, or they say diabetes is contagious and punishable. But all that is not true, because people who are diabetic has to exercise. Exercise is very effective management of diabetes. And again, people who are diabetic can eat any type of food in which they like and which is moderate per se. So basically, diabetes is just a very serious and complex disease if not manageable. I would like to introduce my colleague to take you through the types of diabetes.
Now presenting the types of diabetes. We have two types of diabetes, namely type 1 and type 2. Type 1 diabetes is characterized by insufficient insulin production and requires daily administration of insulin, either orally or being injected directly into the bloodstream. In 2017, there were 9 million people with type 1 diabetes. The major of them live in high-income countries. Neither its cause nor the means to prevent it are known. In the other hand, type 2 diabetes affects how your body uses sugar, mainly in the form of glucose for energy. It stops the body from using insulin properly, which can lead to high levels of blood sugar if not treated. Over time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. Type 2 diabetes is often preventable. Factors that contribute to developing type 2 diabetes include being overweight, not getting enough exercise, and genetics. Now my fellow colleague will be following. Representing the symptoms and causes of diabetes. Diabetes symptoms are caused by rising blood glucose levels. The general symptoms of diabetes may include, as shown in the screen, increased hunger and thirst, weight loss, frequent urination, blurry vision, extreme fatigue, and sores that don't heal. The symptoms of diabetes type 1 and type 2 are the same, but type 1 diabetes symptoms occur in shorter period than type 2. In type 2, the onset tends to be slower, and that is where the slow healing is more common. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, and poor muscle strength, and women may have symptoms such as vaginal dryness, urinary tract infections, yeast infections, and dry, itchy skin.
Today, diabetes is considered polyetiological, meaning that there are several theories for the occurrence of carbohydrate metabolism disorders and problems with insulin. Genes or heredity may play a role in some people. In addition, certain factors can trigger the disease, such as poor malnutrition, refined food, saturated and trans fat, a lack of dietary fiber, overweight, obesity, and stress are also considered potential causes of diabetes. Moving on to my next colleague.
Taking you through, we'll be talking about prevention of diabetes. It is important at home to prevent diabetes. Therefore, to prevent diabetes, one thing that we need to do we need to lose extra weight if you are overweight. Quit sedentary lifestyle and get moving. Eliminate fine carbs, sugar, proceed with foods from diet. Swap the health fats and opt the personal diabetic care program. I will hand over to my colleague.
And now I'll be taking you over through the pathophysiology of diabetes. The pathophysiology of diabetes is related to the levels of insulin within the body and the body's ability to utilize insulin. There is a total lack of insulin in type 1 diabetes, while in type 2 diabetes, the peripheral tissues resist the effect of insulin. Normally, the pancreatic beta cells release insulin due to increased blood glucose concentrations. The brain, in order to function normally, there needs to be a continuous occurrence of glucose. Hypoglycemia or low plasma glucose levels is usually caused by drugs used in the treatment of diabetes, including insulin and oral antihyperglycemics. The pathophysiology of diabetes involves plasma concentrations of glucose signaling the central nervous system to mobilize energy reserves. It is based on a cerebral blood flow and tissue integrity. Arterial plasma glucose concentrations fall and other available metabolic fuels.
Moving on, I will take you through type 1 diabetic. This is a healthy patient and a diabetic. If we can look at the healthy patient, as you can see on the yellow, that is the pancreas produces insulin. And therefore on the blue dots, it's glucose. Therefore, insulin moves glucose to the cells. If we can look at someone who is suffering from type 1 diabetic, as you can see, our pancreas, the immune cells destroy beta cells in the pancreas. Therefore, the pancreas cannot produce enough insulin and more glucose in the blood. I'll hand over to my colleague.
Again, it's just an illustration. It's an illustration of someone's internal organs. Here we have got your stomach, here we've got your pancreas as presented previously in the previous slide. Here our pancreas gives us our insulin to the guts, and again the stomach gives us glucose to the guts. That's basically what happens. After then, from the guts, this combination will go to our organs, and where in our organs, especially with someone who is type 2 diabetic, our organs and muscles will no longer be able to respond to the insulin. That's all happening along this line.
Lastly, presenting diagnosis and treatment. Early diagnosis can be accomplished through relatively inexpensive testing blood glucose. Medical doctors treat diabetes with a few different medications. Some are taken by mouth, while others are available as injections. Insulin is the main treatment of type 1 diabetes because it replaces the hormone your body can't produce. Diet and physical activity can help some people manage type 2 diabetes. If lifestyle changes are not enough to lower your blood glucose level, you'll need to take some medications, and some of those medicines are multiforms, sulfonylureas, sodium glucose co-transporters type 2 inhibitors.
Lastly here we have got our blood glucose meter. Our blood glucose meter helps us at home to be able to identify the type of diabetes in which one have. Here we just simply use them individually at home while you are free seated wherever you are. You can just use it before eating, where it will indicate here a range of between 4 to 7. That's only before eating. After eating, that's where you basically know exactly what type of diabetes in which you have, or in which you have by that time. If it will be below 9, it will mean you are having type 1 diabetes, but then not if it's below 8.5, you'll be having type 2 diabetes. We would like to say enough is enough. Let's fight diabetes.
Enough is enough. Let's fight diabetes at home.
Thank you.